Hi, it's Drew again. In this portion of the training video, we'll be going over closing procedures. Now this occurs once all the patients for that day have been seen and have exited the building. Basically, closing procedures can be broken up into two different areas: cleaning and closing.
To prepare the office for the next day of patients, you will need to make sure each treatment room is clean and tidy. To do so, each room is to be cleared of all dirty instruments, and treatment supplies are to be disposed of or put away where appropriate. Trashes need to be emptied and replaced with new liners. Trashes are then to be put outside in the dumpster. Dremel batteries are to be placed on chargers and Dremels wiped down. The treatment chairs and countertops are then to be wiped down using the Cavi wipes in each room. Make sure each crease in the chair is checked for loose debris and dirt. Be sure to wear your personal protective equipment when using these wipes. The treatment chair of each room then needs to be tilted up and the feet need to be raised so the floor is exposed under the chair. You will need to sweep the room, taking care to clear any dirt and dust from the corners, the room, and chair. Sweep the debris into a small pile by the doorway of the room. Do not sweep the contents onto the carpet. It may seem easier to clean up with a vacuum, but it really allows more dirt and grime to get caught in the carpet. With a small pile of dirt by the door, it may be vacuumed up, or you may decide to use a dustpan. It's your decision. The rooms are then to be mopped. We use a device called a shark in your offices. It is a device that takes water and produces steam, so there's a deeper clean and it takes less time. To prepare the shark, place water in the reservoir using the funnel shown here. Fill until the water is at the rim of the cap. Some may choose to add a bit of cleaner like Spick and Span or Lysol to the water, or you may spray the pad or floor. But it is nice to make sure you involve some cleaner solution so we can disinfect as well as clean. It also provides a pleasing scent to the room. Mop each floor thoroughly, taking care to clean around the chair and under the footpad. The next part of your cleaning duties will be to vacuum the hallways near the procedure rooms. Because you have swept the contents of a treatment room into a pile near the doorway, you may choose to vacuum the hallway at the time you vacuum the contents in the room. Be sure to go slow and keep your eyes open for dirty places and loose items. Do not vacuum up heavy items such as tacks, paper clips, or large pieces of gauze or paper, as this can clog the vacuum and cause damage to the working parts. With the treatment rooms clean and the hallway vacuumed, it is now time to focus attention on your instruments. After use on a patient, each instrument is taken to the dirty room to be soaked in a detergent. At the end of the day, each instrument, still soaking, needs to be scrubbed and rinsed in warm water. Take care when reaching into the basin to retrieve instruments. The rule is, if you can't see it, don't reach for it. Water can be run over any suds that have accumulated in the basin, making visualization difficult. The water may also be drained as to uncover all instruments. Be certain to watch for any sharp objects and let administration know immediately if you obtain an injury from a sharp object. Your health is our number one priority, and it would be foolish to ruin an entire life because it may be embarrassing to say something. After each instrument is scrubbed and rinsed, they are to be wrapped accordingly. Each procedure set needs to be wrapped in a proper sterilization pouch with a sterilization indicator placed face up through the see-through window of the pouch. Simple nail kits are to be left unwrapped and will be taken care of during the opening procedures. All instruments cleaned and prepped will then be placed in the autoclave to be sterilized for the next day. Instructions on using and preparing instruments for sterilization will be covered in our sterilization section to come. Make sure each of your work areas is clean and tidy, ready for the next day, and prepared for anyone who will take your place. You will need to clean the dirty station at your nurse's station and clear all clutter. In general, make sure things look nice and neat. Remember, a clean workstation is a happy workstation. After all the cleaning procedures are accomplished, you will begin the closing procedures. This is the administrative items to complete. All castings that have been taken during the day, either custom orthotics, braces, or shoes, will need to be packaged and prepared to be mailed on the next morning. If there are one or two, you may wait a couple days to send them out so you can optimize your shipping expense. Two things must be present to send out an orthotic mold: the cast itself and the prescription form that the doctor has filled out with his orders. They need to be rubber banded together and placed in a shipping box. You must then seal the box, applying a shipping label, and place the box up front for the front office staff to be able to give to the parcel service, whomever it may be. The items that we cast for that need to be sent are custom orthotics, Ritchie and MSI ankle braces, diabetic shoes, and any other specialty items. You will need to turn each diagnostic machine, ultrasound, and x-ray off and shut them down at the end of the day. In Tumwater, the ultrasound machine needs to be shut down before turning the power off. To do this, press and hold the Save End button found at the top left-hand side of the keypad. It will ask you if you're ready to turn off the machine. Press Enter and it will shut itself down. When it does so, it will tell you it's ready to be turned off. Press the green power switch found on the tray under the machine on the left-hand side. The X-ray machine is digital, so to shut it down you must log out of the laptop program. Turn the switch to off on the wall unit and turn off the black power box that is attached to the pad. In Centralia, the green ultrasound machine is turned off after each patient, so you will not need to follow any procedure to shut it down. But the X-ray machine will need to be shut down specifically. To do so, starting at the developer, you will raise the white top of the developer and tent it under the black flap for the loading platform. You will then reach to the back left side of the machine on top and press the power button off. In the front of the machine, which is your left side, there are a lot of different hoses that are hooked up for the developer liquid and the water. Find the H2O hose and switch and turn it to the open position so water can drain. For more detailed information about the machines, ultrasound, and x-ray, see the Diagnostic Studies section. In Tumwater, you will need to switch the backup hard drives for the digital x-ray machine. This is found in the doctor's office on the desk at the main server. There is an A and B hard drive that will need to be switched out at the end of each day. To do so, pull the USB cord from the back of the hard drive that's in use and insert it into the hard drive that is not being used. This will ensure we have 2 backups for each diagnostic radiograph we take. Any procedures that have been done, whether it's a nail procedure or a soft tissue procedure, will need to be placed in the procedure log to be called the next day. It will be easier if you make a habit to place names in the log as you go. However, you may choose to do this at the end of the day. You will need to place the patient's name, the doctor performing the procedure, and the patient's phone number on this log. The policy is to make the callback to the patient the next day to check on their status. As you place names of the patients you perform procedures on during the day, you will also make the callbacks for the patients who had procedures performed the day previous. When calling the patient, you will need to check their status, resolve any concerns, and make sure you document a phone note in their chart. To make a phone note, see the tutorial titled Making a Phone Note. You will want to be sure to see and check that the surgery room is clean and prepared for any surgery that may occur. This means a sheet on the bed and 3 pillows with pillowcases on them. Instruments need to be clean and available, and the floors need to be swept and mopped in the surgery room. The surgery door must remain closed at all times. You will want to scan the break room for any items you have left, and be sure to wash and clean your own dishes and messes. Be courteous to all you work with. Make sure you check all of your work areas and clean and organize them so those who follow you will be able to work without a mess in their way. This also ensures all of your materials and projects remain organized and are not lost or misplaced. You will need to check and run the laundry for the day so it's clean and ready for use the next day. If you have any questions about how to do the laundry, ask your mother. Or you could ask Dr. Hess. He's pretty feminine. Find time before the doctor leaves to discuss the day and note the good parts about your assistants for the day, as well as any items that need to be discussed that slowed down the flow for the day. These 5-minute powwows will not only help you build a rapport with your doctor, but will help you to see the good parts of your help, as well as those places you need work. They're not meant to be degrading or hurtful, but helpful to your job as a back office assistant. Check the next day's schedule so you will be prepared for the next day and you can prepare any special items you may need.
So with the conclusion of the closing procedures, you are now done with your day. You can go home, you can go out, you can do whatever the heck you want, just please get the hell out of here.